In Medicine Tonight in 1992, the FDA banned silicone gel breast implants for all but a limited number of women, not because of known risks, but because of possible risks. Now, 4 years later, many are asking, was it real or was it a silicone scare? Marianne Childers is here now with more. Marianne.
Linda, there are risks. All implants eventually get hard. They can rupture, cause pain, and make mammography more difficult. But do they cause serious immune-related diseases such as arthritis, lupus, or worse? Thousands of women say they've poisoned their bodies. While there's no question in the minds of women who are suffering, the FDA says that risk remains unproven. For some people, this is the ideal body image. Some are born with it. Others turn to implants, but not this type. This is silicone. Since 1992, new patients can only get implants that are saline-filled. Still, augmentations remain popular. In fact, the number of women who choose this surgery is growing, and questions about the moratorium on silicone remain.
I look at it as the hoax of the century.
Now, new research is also heating up the debate. Recent studies say there's no link between silicone gel implants and disease. Studies at the Mayo Clinic and Harvard, published in the prestigious New England Journal. The American College of Rheumatology agrees. Some believe it's time to take a second look.
I don't doubt these people are sick. The question is, are they sick because of the implants?
The FDA says we don't know, saying only in its most recent update that these newly reported studies provide some reassurance about the long-term safety of silicone gel-filled breast implants. But Ruth Brody, a 7-year breast cancer survivor, has already made her decision. She wanted gel implants from the start.
When I found out prior to surgery that I had an option, that I could wake up a whole person, it made all the difference in the world to me and enabled me to deal with the disease and get on with what I had to do.
Here's the implant.
Right now, the only women who can get gel implants are cancer patients who need reconstruction, women who suffer traumatic injuries, or those who need to have gel implants replaced. You can't get them for breast enlargement.
Do you have a deeper retractor, please?
But even if you qualify, you must be part of a clinical trial and find a surgeon who'll use them. Many today refuse. You also have to get in line. Right now, there's a major shortage of silicone gel implants. Ruth Brody worries they won't be available if she needs hers replaced.
Because they've taken my right away. They've taken my choice away.
But Carla Hobbs-James would like to see implants off the market for good. She got hers after breast cancer surgery in 1991.
Worst mistake of my life. The worst.
Within weeks, she began suffering chronic fatigue and crippling joint pain. 10 months later, the implants were removed, but the pain is still there.
I don't think that I would have had, to this extent, arthritis the way that I have it. I'm too young to have it like a 70 or 80-year-old woman.
Attorney Ken Moll represents more than 500 women who claim to have been injured by implants. He says the Harvard and Mayo Clinic studies are seriously flawed and biased.
The classic example of how you can manipulate the science to conform it to what they want it to say.
Moll's concerned that the research, and some of the researchers themselves, were funded by breast implant makers, that the studies didn't follow enough women for long enough, and that they focused on the wrong thing, familiar diseases like lupus and arthritis, while silicone problems and symptoms often look very different.
It's possible that silicone may cause an immune response that isn't related to classical symptoms or things that we've measured before. So maybe we're looking at something new.
Dr. Lebovic, who's been researching a soybean oil-filled implant, says with so many women so sick, more research is critical. And that may be the only thing that people on both sides of this issue agree on. So was it real or was it a silicone scare? Well, the frustrating thing is that 4 years later, there are no definitive answers. Even the FDA says it's going to take decades of research, and many of the important studies haven't even begun. And Linda, in the spirit of full disclosure, I'm on the honorary board of Why Me, which is an organization that supports and helps women with breast cancer.
Thanks, Marianne.